Good morning. My name is Dr. William Mapham. I'm from South Africa, and my passion is improving healthcare in rural areas. Vula, my company, was created from my experience as a rural healthcare worker and later as a specialist to get patients connected, to get healthcare workers connected to each other, to get patients the right healthcare at the right time. Vula was then rated by the UNDP as one of the top 4 most innovative solutions globally improving access to healthcare. What's quite interesting is it's actually been co-created by healthcare workers in Ghana, Ethiopia, Namibia, Botswana, Lesotho, and South Africa. So it's really been developed from the ground up. They love using it, and so people start using it and they share amongst each other, and the system grows on its own. To quote one, Vula brings the whole world of specialist healthcare to rural people, which they never had before. And at a high level, the Ministry of Health calls Vula the glue that holds the health system together and the oil that makes it work efficiently. Most healthcare records for patients with rare diseases in Africa are still on paper. And you can't save the world with AI if there's no data. So we have to find a way to make the data visible. So because healthcare workers love using Vula, the data is digitized. And the world needs diverse data sets so that developing countries can be included in the development of new technologies. We love to partner. We believe that healthcare can only be delivered through partnerships. Last year we were here, we presented our work on 2 different rare diseases. We have since then scaled through our partnerships with Novartis, Sanofi, the Global Fund, into more areas. And now we're very excited to hopefully work with Horizon to help more people to improve the health systems for rare diseases for more people and in more areas. The great thing about healthcare is if you provide better healthcare, it's also the best thing for the environment. And you've seen some examples of that earlier. With healthcare in South Africa, we have 110 different types of health worker using Vula, all the way from community healthcare workers all the way up to medical geneticists. And it's used in over 75 different specialties. And the barriers faced by patients with rare diseases are typically cost, access to healthcare close to where you live, and transport. And so with Vula, having such a comprehensive approach, you can improve the diagnostic journey, you can decrease the costs, and most importantly, decrease the transport burden on many patients. We have a great team. I'm from the Rural Doctors Association. We have Tanya, who's built us scalable systems from Goldman Sachs. Gareth has built a lot of digital healthcare systems through Africa. And Stacey's our CEO who makes everything happen. So last year in October, we helped our 1 millionth patient. We now want to give hope to 1 billion. And we believe that Vula is the right organization at the right time with the right people, ready to change the world with the right partners. Thank you very much.
All right, judges. Sheetal.
Congratulations. I love this idea. I think it's so needed, and it's wonderful to see your success. I see that you, with this technology, can better identify rare diseases, and I see that you can access specialist wisdom in order to help treat them. Do you think, or what are your thoughts on sort of the last step of that, is to access to that treatment and having patients get that treatment?
So I can give you an example from our work with Sanofi. We did a survey of all the healthcare workers on Vula, and most of them didn't know much about rare diseases. So we did a campaign filling in the information gaps. And very few of them actually knew that you could order testing kits and they would be delivered to you no matter where you were in the country. And so at the end of the campaign, more healthcare workers knew about rare diseases, more tests had been done, and patients had ended up on treatment. So that was kind of one of the success stories that we've had there. But the real kind of like ethos is that for rare diseases, you have to have a very big net to catch them with holes of exactly the right size. So if you have educated 110 different types of healthcare worker, suddenly you've got that big net. If they know the information, they know where to find them, and then hopefully get access to treatment.
Thank you.
Vikram.
what would you do with the prize if you were to win it? Or how would you invest it?
So the good thing is we've got examples of how we've worked with other pharma companies. So for example, with Novartis, with sickle cell disease in northern Ghana, in the Upper East Province at the Navrongo Research Center. So within 3 months with their funding, it was half the amount of what the Horizon Fund is, but we launched in northern Ghana. It's now helping pick up children with sickle cell disease, and they get onto treatment. So with the prize with Novartis, so the prize with Horizon, we kind of mirror that, but we'd have the capacity to do twice as much as we've done with Novartis.
Ricky.
I just want to ask the question, which is quality versus quantity. Rare diseases has a very specific need, very specific kind of a requirement. It's not so much about getting 1,000 people to sort of be able to sort of, be readily sort of prescribed, but how do you manage quality of the person and various other pharmacovigilance aspects of what sort of, review happened and all of that. So we'd be interested to know how do you manage quality versus quantity.
It takes time to get quality. So what we found is that the rural healthcare workers used to make referrals and learn case by case. And then we had a case which was 7 hours north of where I worked. And all of a sudden, the nurse stopped making referrals. And we kind of panicked a bit. We thought maybe she'd had an accident or something. But when we contacted her, she said no. She knows what to do now. So it did take 2 years, but suddenly you had quality in an area that never had it before. And once a month, a specialist goes to work with her to see the complicated cases. So it does take time to get quality, yeah.
Edda.
Thank you very much, and congratulations. Good to see you again this year. My question would be, possibly maybe you could give us an example with Gaucher's disease, and from South Africa, as that is where you first did your work. How much of an impact has this had on the time it takes to get diagnosis, if you have that information or that observation? How well has it improved the journey for the patients?
I'm so glad you brought up that example. Let me show you. So you'll see on the app, right at the top of the page, we ran a campaign on Gaucher's. I can personal example, at medical school, I remember my last lecture. It was on rare diseases. And that's as much as I could remember about rare diseases at the time. So now all of a sudden, every single healthcare worker using Vula could access that information. There were other adverts throughout the app. And once a month, all the departments using Vula get more information in a kind of a pamphlet format with all their data. So suddenly we were able to reach more healthcare workers. That campaign was successful in terms of making sure people ordered more tests. And in that campaign, I think in the first 6 months, 4 more patients ended up on treatment. So the numbers aren't massive, but you're finding people that are very hard to find in areas that aren't typically reached with specialist healthcare. And this all happens in the public sector, which is often underserviced compared to the private sector.
Wonderful. And we are just about out of time. So thank you so much, Will.
Thanks so much. Yeah.